Thank you for the wonderful bio there and introduction. So, hi everyone, I'm student Dr. Mettu, and I will be presenting on obstetric characteristics and outcomes of gestational carrier pregnancies. So, a systematic review and meta-analysis. And this was just like a topic that interested me personally, as I have not had much education nor exposure regarding surrogacy pregnancies. And I hope you come out of this presentation learning something new, just like I did. Um, Okay, so before we get started, I would like to review some key definitions for terms that will be used throughout the presentation. So first, we know that gestational surrogacy involves a woman carrying a pregnancy for intended parents. And in gestational surrogacy, the embryo is created using either the intended parents or those from the donor, and it is then transferred to the gestational carrier. However, this is different from traditional surrogacy when the surrogate's own egg is used to create the embryo. And lately, gestational surrogacy is becoming increasingly common. And the last term that I want to cover is ART, or assisted reproductive technology, which encompasses medical procedures used to address infertility. And while the research doesn't provide a specific definition for ART, they offer several insights into its applications and implications in the context of gestational carrier pregnancies. And ART is a key factor contributing to the rising number of gestational carrier pregnancies, and increased awareness of gestational carrier pregnancies, greater accessibility of assisted reproductive technology services, and evolving surrogacy regulations are all cited as reasons for this trend. And currently in the US, gestational surrogacy, which relies on ART, is recommended when intended parents face various obstacles to pregnancy. So these obstacles could be biological, medical, ethical, or psychosocial in nature. And ART procedures like IVF are associated with an increased risk of multiple gestations. This in turn influences adverse perinatal outcomes in gestational carrier pregnancies. And we'll discuss this topic further like later on in the presentation. So now coming to the research question. So the study focuses on comparing gestational carrier pregnancies to non-gestational carrier ART pregnancies and general non-ART pregnancies while analyzing the risks of complications such as hypertensive disorder, preterm birth, low birth weight, and severe maternal morbidity. So here's the outline of the study before we dive a little bit deeper here. So this research investigates the maternal characteristics and obstetric outcomes associated with gestational carrier pregnancies. And the study uses a systematic review and meta-analysis of data from multiple studies to assess risks of hypertensive disorders, preterm birth, low birth weight, and other complications. So the authors find that gestational carrier pregnancies have similar outcomes to pregnancies conceived through ART technology, but may have higher risks than general pregnancies. And they suggest that further research is needed to better understand the risk profile of gestational carrier pregnancies and inform patient counseling. So today we're going to be looking at gestational carrier pregnancies, as I've discussed. So this research was established or published this last July in JAMA Network. It is a systematic review and meta-analysis, which means that they combine data from multiple studies to give us a more comprehensive picture. And the researchers looked at 6 different studies covering a wide range of pregnancies. So we're looking anywhere from 28,000 gestational carrier pregnancies and over 1.2 million non-gestational carrier pregnancies. And in my opinion, this is a solid foundation for understanding gestational carrier pregnancies compared to other types of pregnancies. So both those using ART and general pregnancies. And something else that we should look into is the American Society for Reproductive Medicine's guidelines. And so they have a set of guidelines for those who are gestational carriers. So ASRM recommends that gestational carriers be between 21 to 45 years old. They should have already had one successful and uncomplicated pregnancy, and that they should have a stable family environment. So it definitely sounds like those guidelines are for selecting gestational carriers that are at lower risk for complications. So the question is, did the research reflect this? And yes, it did. So the research found that a low rate of nulliparity amongst gestational carriers, meaning very few of them were going through a first-time pregnancy, And this finding aligns with the ASRM's recommendations of selecting carriers with a prior successful pregnancy. So it seems like the guidelines are pretty effective. And the research looked at a variety of factors. So one interesting finding was the prevalence of gestational carrier pregnancies. And this was surprising to me when I was looking into this research. So they actually make up a very small percentage of all pregnancies, so only 0.1%. And even with ART pregnancies, they represent just 3.8%. And to me, that's a surprisingly small number. But I guess when you consider all the different ways that families are formed, gestational surrogacy is still relatively uncommon. But for those who do choose this path, what kind of risks are we talking about, right? So one significant finding was the higher rate of multiple pregnancies in gestational carrier pregnancies that use ART, and carrying multiple increased the risk of certain complications. So carrying more than one baby at a time puts additional stress on both the mother and the babies. And gestational carrier pregnancies also showed an elevated risk of hypertensive disorders compared to general pregnancies. However, the risk level was comparable to other pregnancies using ART, which suggests that ART procedures themselves might play a role. So it's not necessarily about being a gestational carrier, but more about the technology involved in the process. And interestingly, the risk for preterm birth and low birth weight were similar between gestational carrier pregnancies and other ART pregnancies. So this again points to the procedures themselves potentially influencing these outcomes. So it seems like regardless of who carries the pregnancies, it might have certain inherent risks. So again, just to recap some of the medical risks, we have hypertensive disorders, and gestational carrier pregnancy may have a higher risk of hypertensive disorders, potentially due to immune responses to foreign antigens from the embryos. Although gestational carrier pregnancies show similar rates of preterm and low birth weight compared to ART pregnancies, they tend to have poorer outcomes than general pregnancies. And then, of course, you have placenta-related issues, and then you have a higher likelihood of multiple gestations, which again increases complications. And finally, you have severe maternal morbidity. And unfortunately, there's limited data on severe maternal morbidity in gestational carrier pregnancies, but risks include anything from hemorrhage, ICU admissions, and postpartum complications. So now let's look at some figures from the study. So in panel A here, we see that frozen embryo transfer, so FEET stands for frozen embryo transfer, is significantly more common in gestational carrier pregnancies than in non-gestational carrier pregnancies. And in panel B, we see that single embryo transfer, SET, is slightly more common in gestational carrier pregnancies, but the difference is not statistically significant. So both analyses show high heterogeneity, meaning the study's findings vary widely, which could impact the reliability of the combined results. In this figure, it shows a meta-analysis, which is a way to, again, combine data from multiple studies about the risks of preterm birth and low birth weight in gestational carrier pregnancies compared to non-gestational carrier pregnancies. So in simpler terms, this figure suggests that gestational carrier pregnancies might have a slightly lower risk of both preterm birth and low birth weight compared to non-gestational carrier pregnancies, especially when adjusted for other factors. However, many of the results are not statistically significant, meaning the differences might be due to chance rather than a true effect. So the next question I had was, are there areas where gestational carrier pregnancies showed better outcomes? And it seems like there are certain areas. So the research revealed that gestational carrier pregnancies had lower rates of cesarean delivery compared to both general pregnancies and ART pregnancies where the intended mother carried the pregnancy. And it likely has to do with the rigorous selection process for gestational carriers that I discussed previously. So that was the American Society for Reproductive Medicine and their specific recommendations, such as being between the ages of 21 to 45, having already had a successful and uncomplicated pregnancy, and having a stable family environment. So did the research look at serious complications? So they did examine rates of severe maternal morbidity and mortality, but they flagged them to be rare across all pregnancy types, including those involving gestational carriers. However, they also emphasized the need for more research, specifically focusing on these rare but serious complications in gestational carrier pregnancies to have a more complete understanding. And of course, we always want to have as much information as possible to make an informed decision. So now let's examine why gestational carrier pregnancies carry certain elevated risks and what is causing these differences. Like what factors contribute to these slightly higher risks compared to general pregnancies. So there are a couple of primary factors at play here. So first, you have the ART procedure themselves coming with inherent risks regardless of who's carrying the pregnancy. So essentially the risks are baked into the process. So the second factor is carrying multiples inherently increase the risk of various complications, which could explain why gestational carrier pregnancies see higher rates with those complications overall. And the number of embryos transferred is also a crucial factor to consider as well. And another potential factor that contributes to elevated risk is the higher use of frozen embryo transfer in gestational carrier pregnancies. And some studies have shown a possible link between frozen embryo transfer and increased risk of hypertensive disorders. Okay, so now let's look at the limitations of the research. So we had data constraints. So most studies that are retrospective in nature, they are lacking control over confounding variables and limiting the ability to establish causation. And the second limitation is that the limited number of studies provide direct comparison between gestational carrier pregnancies and non-gestational carrier pregnancies without ART, which restricts comprehensive understanding of gestational carrier pregnancies' specific risks. And the third is that there's likely the presence of publication bias, which could skew the findings towards like more positive or adverse outcomes. And fourth, the studies did not consistently report key outcomes like previous pregnancy complications or psychological evaluations and physical evaluations of gestational carrier pregnancies impacting the robustness of the results. And lastly, there's a significant variation in study design, participant characteristics, and outcome measures, which again leads to that high degree of heterogeneity across the studies. So when we discuss topics like this, we still need to look at the ethical considerations as well. And what are these ethical considerations? What are the key considerations that come into play with gestational carrier pregnancies? I think these are very like important questions that need to be incorporated into the discussion. And it's definitely a multifaceted issue touching upon areas like informed consent, the well-being of all parties involved, and the potential for exploitation. So in terms of informed consent, it is essential for gestational carriers to understand the risks involved, especially given the higher risks associated with ART procedures. And in terms of psychological impact, there should be screening and support as needed for gestational carriers who may experience emotional and psychological strain related to carrying a child for someone else. And lastly, we should consider autonomy and welfare. So ensuring that the gestational carriers are not unduly influenced or financially coerced and that their health and welfare are prioritized. So the key takeaway is that gestational carrier pregnancies have similar outcomes to other pregnancies that use ART, and they tend to carry slightly higher risk compared to general pregnancies. And of course, the $1,000,000 question is, why does all of this matter, right? So understanding the potential risks and benefits of any pregnancy is essential for informed decision making. And that's especially true for gestational carrier pregnancies where you have multiple parties involved. And it's about empowering everyone, right? So the intended parents, the gestational carrier, and the medical team to make the best choices for a healthy pregnancy and a positive impact for everyone involved. So let me conclude this presentation with talking about some of the future considerations for where this research can go and what else we can do with this information. So the discussion needs to consider advancements in genetic testing. So pre-implantation genetic testing allows for selection of healthy embryos, which could potentially reduce the need to transfer multiples and mitigate some of those risks that we had discussed before. And also, as technology evolves, we have more tools to help us make informed decisions about these embryo transfers. But even with genetic testing, the ethical considerations still remain pretty complex. So it seems like there are just many layers to this conversation, and it's not just about the medical effects, it's also about the values and perspectives and weighing difficult choices. So, of course, we still have a lot to learn about the long-term impacts of gestational surrogacy, both for the children born through this process and for the individuals that make these families possible. So we've been focusing on the pregnancies themselves, but I think it's also crucial to consider the well-being of everyone involved long after the baby is born. So what kind of research would help us understand those long-term impacts, right? So maybe future studies could explore the psychosocial development of children born through gestational surrogacy, comparing their experience to those of children conceived through other means. And this would help us understand if there are any unique challenges or advantages associated with this path to parenthood. And we also need to understand the long-term experiences of gestational carriers and intended parents. So research can maybe delve into the emotional and social experiences these individuals navigate. So do gestational carrier pregnancies experience any lasting psychological effects from their experiences? And how do intended parents adjust to the unique dynamics of their family formation? So these are all important questions to explore. And it's just a reminder that gestational surrogacy is about so much more than just the medical procedures. And it's a complex and profound journey with long lasting impacts and implications for everyone that's involved. And that concludes my presentation, and I'm open to any questions.